Patient care is at the heart of what we do. It's just really difficult sometimes with obviously staff shortages and not being able to access the right kind of services at the right time. So the transformational model will be helpful for all of us staff from different professionals to work together collaboratively and get the right patient care at a localised level.
This is the first time, at least in my memory, where there has been a specific focus on community mental health services with regards to funding and a need for change. And this has been waiting for a long time. From my point of view, I'm trying to look forward and see this as a massive opportunity of how we can actually make things better.
This is a national initiative. There's a lot of money that's coming with it. This isn't a money-saving exercise. So there's just under £1 billion worth of money that's being put into the community transformation each year. You can't have a one-size-fits-all from a national level. You can have some national standards, but that has to be translated to meet the needs of the local population.
The best part for me was that they identified the problems within me, the symptoms. They could have just left it, but they didn't. They suggested that I go get tested. So for that I'll be grateful for, because they identified the problem. Within the services, everybody seems to communicate with each other, and that's good. Outside of the services, nobody seems to know what's going on. And I think that's where the services does fall down a lot. And also I think the paperwork. I know it's all data protection, but the fact that I can go to a neurologist and I have to repeat my story all over again, and then I'll go to another doctor and I have to repeat the thing all over again. Having the paperwork available, the scans available, the diagnosis available to each person that I go to is important. Then it takes a lot of the stress and the aggravation out of having to go see different people for different things. They automatically know.
You were thrown into it, and there's a lot of terminology to pick up immediately, and that could have been a lot better. There was a problem of organisation, there was a problem of need, and also resourcing. Almost nothing with the dementia disease happened 9 to 5. My mum would have crises about a couple of hours after she woke up in the morning, which could be 5 a.m, and sundowning at 10 p.m. before that. Everybody was off shift, apart from me, seemingly.
There should be more compassion and, like I say, more psychologists, more psychiatrists, more therapy. Getting a diagnosis was impossible. And if the treatment that I've had since 2016, if I'd had that treatment in 2008, maybe I wouldn't have lost so much years of my life and my children growing up.
The major good bit was all the fantastic people I've met on the journey, and they have encouraged me wherever possible. After the diagnosis, I expected somebody to come along and talk to me, but nobody did actually come along and talk to me. So this is one of the bad bits that I've received.
When we've listened to service users, carers, family members, we've known now for a long time that the current community mental health services are not fit for purpose. So essentially we have a system that is broken and that needs to change.
I think that services are set up for people to come to them. And that just doesn't suit people's needs a lot of the time, particularly when we're talking about people with complex mental health needs and drug and alcohol use.
The patient doesn't care who provides what service, all they want is to get the right service for them, and it needs to be something that's very, very simple, easy and accessible for them to get what support they need.
If I was to make one change, one suggestion would be to include all of these services within the NHS at the beginning, so that everybody's part of the restructure of the mental health services, or TEWV, so that you get better fluidity between services. They need to structure it the way they would care for cancer. You go there and the doctor remotely thinks that you've got cancer, you're immediately referred and you're treated as such. And within a few months, you can have diagnosis and treatment. Mental health services is not like that.
The difficulties at this moment in time is each service works on its own basic remit, and what we're trying to do with this transformational model is bring us all together to work collaboratively and work in partnership with each other.
It's moving from working in silos to working together, and there's quite a lot of challenges involved in that, but that's the ambition.
I think a lot of the barriers have been ease of access, waiting lists, not being taken seriously, feeling that they're being dismissed, not being valued, not getting the right help at the right time. They've been the kind of common themes that have come through from the surveys that we've had through.
I think it really is that gateway into the service that needs looking at closely, so it's more welcoming and people feel as if they are not alone at that first point of contact.
Within the crisis service, patients only stay with us for a short time. It's basically to identify what needs that they've got and what service is going to be best for them. When they finish with the crisis team, there's often a delay before they go into their secondary services. This delay can be up to 3 or 4 weeks. So instead of the person feeling concerned that they've been dropped by a service, one of my jobs as a peer support worker is to see people through to the next service, allowing them to have continuity with their care.
I think there's a real opportunity where people out in the community want to help each other and have done so during the pandemic. I think that this is an opportunity right now where we can do something completely different, rip up the rule book, start again and think about what do people need and how can we do that best for our communities, rather than thinking about how do services operate now and what should that look like.
Our voices are heard, we're able to give our opinions and our ideas, which helps, us staff to put this model forward.
This is a time for the workforce and for people involved with this to think about how do they want their service to look, and to sort of pause and take it forward and actually see what are the things that are helpful, what's the things that are useful, and start implementing those.
This is our one big chance to get this right, to help people develop as a workforce, to deliver that safe and effective care in cooperation with all of our partners.
The most important thing is the principle that going forward, when we implement this framework, no patient will be refused or shown the door. All referrals will be accepted and there's no wrong door, and there will be a wraparound service for the patient at all levels.
In the past, we've tended to divide people off depending on their age and a diagnosis, and it's really looking at what is somebody's needs. So we want all of our services to be accessible to people who are living with a dementia. We want all of our services to be available to people, and different therapies available to people irrespective of their age, to make sure that there's real equity of service and provision for people. And there's a real move to provide that within the staff group, which is exciting.
These kind of events, you go through a kind of bit of a roller coaster at the beginning, quite a lot of trepidation that you're actually going to get anything done. Then you start moving forward and get quite excited that you're making progress, then look at the stumbling blocks along the way. But at the end of it, we've actually got an excellent result, I think.
It's been fabulous to have people who are experts by experience that have been journeying alongside of us over this time. I feel like we've learned lots from them, and there's lots more to learn.
If they can implement these changes, it'll be great for everybody. Really sort of service users and also the staff. So yeah, really hoping that this starts to work out.